So I'm Sandra and Jacinda, and I will be presenting on optic neuritis. We're going to start with the introduction, the etiology. We're going to go over the pathophysiology, the history and physical part of optic neuritis, the evaluation, the diagnosis, treatment, some recent findings, sources, and then we'll leave room for questions at the end. I will now pass it over to Jacinda to go over the introduction.
Thank you, Sandra. So what is optic neuritis? Optic neuritis is occurs when there's swelling or inflammation, and this results in damage to the optic nerve, which is a bundle of nerve fibers that transmit visual information from your eye to your brain. So these signs and symptoms of optic neuritis that we'll discuss later can be a first indicator of multiple sclerosis, which Louisa and Joanne will talk about later, or it can be seen in the later stages of MS. We also see optic neuritis occur with other conditions, including infections or immune diseases. Currently, there's no exact cause of optic neuritis, but it's believed to be caused or developed when when the immune system mistakenly targets the substance covering the optic nerve. So that substance is the myelin, which we know helps in electrical impulses traveling quickly from the eye to the brain, and this helps visual information to be converted. So when optic neuritis occurs, it causes inflammation and damage to the myelin, and it disrupts this process and affects vision. So as discussed earlier, optic neuritis are often associated with other autoimmune conditions. So this can be multiple sclerosis, which is a disease in which the autoimmune system attacks the myelin sheath, covering the nerve fibers in the brain. It can also be seen in neuromyelitis optic, a condition in which inflammation affects the optic nerve and spinal cord, or myelin oligodendrocyte glycoprotein, or MOG antibody disorder, in which there is inflammation in the optic nerve, spinal cord, or brain. So these can be caused by, optic neuritis can be caused by infections that precipitate autoimmune reactions. So this can be bacterial diseases, viral diseases, or drugs and toxins. So Sandra will now talk about the pathophysiology of optic neuritis.
So, reoccurring episodes of optic neuritis indicate more generalized diseases that include neuromyelitis, optica spectrum disorders, which is NMOSC, and myelin oligodendrocyte glycoproteins, IgG, which is also known as MOG. Detection of APQ P4 IgG antibodies confirmed the diagnosis of NMOSC. And then patients with MOG are more likely to experience improved visual function after optic neuritis, and they may have lower spinal cord involvement. Both of these disorders affect the optic nerve, the chiasm, and the optic tracts, so bilateral vision loss is common. And then to the right here, we can see a figure of a healthy nerve and a nerve that's affected by multiple sclerosis, which obviously Joanne and Louisa would discuss later. So the history and the physical part of optic neuritis, patients may experience reoccurring photopsias, and vision loss may be exacerbated after exercise or elevation of body temperature. Visual symptoms due to optic neuritis tend to resolve over several weeks to months and visual function improves near normal levels after 6 months in the majority of cases. However, there are instances where qualitative visual changes persist for the duration of a patient's life. And then to the left here, we can see the swelling of a patient's eye with optic neuritis.
Okay, so how is optic neuritis diagnosed? So in the images, we see our routine eye exams. We see a microscopy and a pupillary light reaction test. So the routine eye exams help in checking vision and the ability to perceive colors, as well as to measure peripheral vision. The ophthalmoscopy is performed by shining a bright light into your eyes, and this examines the structure at the back of the eye to evaluate the optic disc, where the nerve enters the retina. So in patients with optic neuritis, the optic disc becomes swollen. And then in this image to the far right, we see the pupillary light reaction test, in which a doctor moves a flashlight in front of your eyes to see how your pupils respond when they are exposed to bright light. So in patients with optic neuritis, we see that the pupils won't constrict as much as pupils in healthy eyes when exposed to light. Further evaluation includes magnetic resonance imaging, or MRI. So this is when a patient receives an injection of contrast solution to make the optic nerve and other parts of the brain more visible on the images. They can also get blood tests done to check for infections specific antibodies. So this is mainly done to test for myelin oligodendrocyte glycoprotein antibodies, as well as optical coherence tomography, or OCT, to measure the thickness of the eye's retinal nerve fiber, as well as to see if it's appearing thinner, which would be a characteristic of optic neuritis. Other tests include visual field tests. This measures the peripheral vision of the eye to determine if there's any vision loss. And so with optic neuritis, we can see that there's a pattern of visual field loss. So this is an indicator for optic neuritis, as well as visual evoked response, in which a patient sits before a screen and alternating checkerboard patterns are displayed, with a head wire attached to their head with small patches to record the brain's responses and to see if they are responding to these electrical signals. So how is optic neuritis treated?
So for treatment, vision will return to normal levels over weeks to months with or without treatment. But if you're treating it right away, you can use either the intravenous methylprednisolone, and you could take 5 to 1,000 milligrams once a day for 3 days, or you could do oral prednisone 1 milligram for 11 days. And to the right is just a figure of prednisone. And then as for recent findings, advances in technology and immunology have advanced the understanding of pathologies driving inflammatory optic nerve injury. Clinicians are now able to interrogate optic nerve structure and function during inflammatory injury, rapidly identify disease-relevant autoimmune targets, and deliver timely therapeutics to improve visual outcomes. And here are our sources.